This top killer among women. My name is Shiko Kaitani, and remember, you can get in touch with us through our social media platforms as at K24 TV on Facebook and Twitter. We also do have our WhatsApp line that is active, and we are looking out for your text messages. Of course, if you would like to call in, we'd love to hear your voice. Those numbers are at the bottom of your screen. Still with me, I'm calling them fun, fearless females because they are here, taking it by the horns and even talking to us about what we need to know when it comes to cervical cancer. Dr. Jane Wakahe, gynecologist, is still here with us. Right at the center is Millicent Kagongo, who is a cervical cancer survivor. And last but not least, Benda Kithaka, founder of Women for Cancer, still answering some of those questions that are coming in. Benda, let me just throw this one to you, because you are obviously doing a lot of work on the ground as Women for Cancer. What would you say is the reason women are just not showing up for screenings?
Wow. Our society,
Yeah.
it's not just about women. Our society has not yet embraced preventative health. We don't have the essence where people show up in hospital because they're not sick, they just want to be checked. We don't have that as a culture. And it's something that needs to change. Men show up in hospital when they're really, really sick, when the woman has forced them to go. Women will only show up when the signs and symptoms have come, and yet we've heard that the signs and symptoms come way later. We should not wait for that. There is also the fear. When people hear cancer, they are thinking death, because we see so many people dying of cancer. So the fear of death could also be preventing women. The fear of the process itself. If at all we don't talk about sex, are we going to have somebody else go and examine us when we're not having children? Because that's the only time people allow for them to be checked.
Absolutely.
And so that fear needs to be overcome. First of all, to demystify screening. That screening is a 15 minutes affair. 5 minutes of undressing and getting ready. 5 minutes of dressing. The in-between is the 5 minutes of screening.
Okay. Hold that thought, because I'd want you to also explain to us about screening. Joshua from Kirinyaga is on the line. Let's hear from Joshua. Joshua, good morning.
Morning, Shiko.
Yes, karibu Joshua.
It's a very, very, very somber topic when we get to discuss about things like cancer. Sometimes I feel, and I would wish to call upon the media fraternity and the health sector stakeholders in this country to go further and push the government, appeal to the government, lobby the government to see if we can do something to put into place infrastructure to ensure that we take care of people who are suffering from some of these diseases. Because it's gotten to a point in our country that there has been too much talk about cancer this, cancer that. But when you look at what the government is doing, it remains the same old stories of doom in families, whereby if a family member is diagnosed with cancer, then you know that's it. Now, either your family is left totally impoverished, and you are certain that you are going to lose your loved one. And finally, I want to appeal to the religious community in this country, especially the Catholics. I have seen in the past the Catholic has been on the forefront most of the times, opposing attempts by researchers and medical experts on some of these things. Like last time, they talked about there were issues with polio. When the vaccine on the cervical cancer came out, again, they had their own issues. I want to tell the Catholic Church, which I respect and I grew up in, that please confine yourselves, limit yourselves to matters of spirituality, and leave matters on health to the experts and to people who know about it. There are enough problems in our churches, so them fast and don't interfere with what the experts are trying to do to save people's lives. And finally, to our doctor, I think our doctor talked about some symptoms of cervical cancer, and she said that at times you have smelly discharges, and sometimes you might have some blood clots. But maybe that doesn't sound alarmist. I want to say that There are some people who also have bad smells when they don't have any cancer. So that's on a light note, Chico.
Thank you, Joshua. Thank you. A mouthful coming in from Joshua as always every morning, but he does stick with us. Thank you so much for that. We do have text messages I want to take a look at very quickly. Hello, I'm Nancy from Kahawa West. I'm 22 years old. Where can I get vaccinated? Okay. Another question. Let's see if we've got any more very quickly that we can take a look at. Hello, is cervical cancer sexually transmitted? Any more? Good morning. Is a girl 12 years old of age eligible for the HPV vaccination? Okay. So as we'll give Dr. some of those questions to answer, but you are talking about screening and demystifying what screening is, because people view screening as this very painful process, Benda, and some women say, "Hey, come on, watch your tweet, guy." But you are demystifying it for us.
Yes. Some of the things we fear in life don't actually happen as we anticipated. Screening is one of them. Yeah. Somebody comes and tells you, "Oh my gosh, it was so uncomfortable." Guess what? She's gone for her screening. Yeah. She has already done it. She knows her status. Yeah. You haven't. You take it as gospel truth and decide, you know what, it's uncomfortable, I'm never going. Yeah. Guess who is at risk here? It's you. So my call to women is 5 minutes undressing, 5 minutes getting dressed, 5 minutes in between to get checked. And there are 3 different types of screenings. There is the HPV DNA testing, which Dr. talked about here. There is the pap smear, which again is taking a sample, taking it to the lab and checking. And then there is the visual inspection using acetic acid, which to the common layman language is checking the cervix to see whether there are any cell changes that could potentially turn into cervical cancer. These 3, each of them takes less than 15 minutes. And in that discomfort, I always like to tell women to think about high heels. We'll have high heels. Wearing high heels the whole day is a very uncomfortable affair. And it's embarrassing because by the end of the day, you're walking in a manner likely to suggest by the time you get to your gate, you want to remove them and throw them. Yes. It's uncomfortable. It's uncomfortable. But we do it daily. You do it daily. Okay. So this is a once in a year or once in every 5 years activity. Yeah. Let's do it. Okay. Very quickly, we've got a caller from Kajiado, I understand, who's on the line. Good morning.
Good morning to you.
Yes.
My name is Leposo.
Yes.
A nurse. Hello.
Hello. Yes, go ahead.
A nurse working at some private clinic and somewhere very remote within the county.
Okay.
I'll be very brief, although I have a lot to say. Hello?
Yes, go ahead. We can hear you.
I'll be very brief, although I have a lot to say.
Yeah.
Several mothers have passed away, maybe due to either cervical or upper cancer. Okay. Today I've just sent some videos of a patient that I'm dressing by WhatsApp. Okay. When some of the stakeholders talk about awareness. Hello.
Hello. Yes, go ahead.
It is so sad that wherever I am, those are stories. Awareness, no campaign. People are just there. Okay. So I would wish or request that those who are concerned, to get maybe in touch with somebody like me who is at the machinery level. Okay. All right. Thank you so much. Okay. Leposo, thank you so much for, of course, your suggestion. Apologies, the line isn't too clear. But getting back into this discussion about screening, can we please speak to the women and even the men who are the heads of the home that, by the way, if your wife is going to go and get checked down there, there is nothing sinister about it. Women will say, I'm not going to have a male gyna to check me down there. And that is part of the problem. We see them. Those texts come in because they will say, mzee amekataa. There's no way I'm going to go and get checked down there. Benda, I can see you know.
Yes.
I often wonder, would you rather she was checked when she's healthy and told she's okay, or when she has no choices because now the disease is invasive and she really has to be checked? Would you rather? And knowing the journey of prevention, or the early detection, which again is prevention, because it's treated 100% recovery, versus walking her the journey of treatment, which takes time, is invasive, sometimes it's life-threatening. Would you rather? So we need to demystify cervical cancer and say that it's the one cancer that gives us time. Time to prevent with the vaccine, time to get screened and told you're okay. Screening is not always about you're sick. It's also about you're okay, go back, come back after 5 years.
Absolutely.
Time to treat it before it becomes cervical cancer. When the cells are changing, and time to treat it, often to 100% recovery, if discovered early.
Mili umenyamaza sana. Now, speaking about why even people don't come out. Sometimes when we have had the talk about cancer, this, cancer, that, the first thing that comes to mind is the cost. So unapata, mtu amedecide ataketi tu nyumbani, I'm not going to go forth and start getting treatment for cancer because of the cost behind it. Nasema tu hiyo ndio Mungu amedecide. So this is what he has decided for me. Such is life. Your thought, and even for your thoughts on it, the cost implication for your treatment.
Then it was a bit difficult for me, but now it is easier to get treatment even if you don't have any. Like me, first of all, when I started the symptoms at the age of 20, my husband went off, and I got a lot of stigma in the community because mwanamke akitoa damu ni kama ni laana, ni kama ni kiboko ya Mungu kwa community. Kwa hivyo unaona hata ukitoka mtu anakupoint kwa mgongo. Naona huyo. Kuna kiboko ya Mungu. And then the same 2010 I also lost my second born. Watu walibelieve vitu mingi sana. Kupata treatment, kama uko mgonjwa uko nje kupata treatment, usiangalie mfuko. Mimi sikuwa na kitu yoyote. Na kuna watu walijitokeza, si ati watu wenye wako na pesa. Mtu anasema nilichukua 50 bob. Hata wale wagonjwa wenye tulikuwa tunatibiwa nao Kenyatta walichangia sana kwa matibabu yangu. And then saizi kitu yenye sijasema, niko na support group, na kuna watu wanapata treatment kama wana pesa through that support group. Si ati ni sisi tunalipa, sababu mimi bado niko na majukumu yangu na sifanyi kazi. But kuna vile unaweza enda kwa Kenyatta kuongea na daktari ama na social worker, analipa treatment yako. Kwa hivyo wewe jitokeze enda ukapata treatment. Na pia kuna organizations zingine, kuna organizations zingine kama Women for Cancer wanasaidia kulipa NHIF kufanya nini. Kwa hivyo kama umepatikana uko na saratani, jitokeze tu utapata treatment.
Very important.
Na kuna NHIF. NHIF ambayo mtu akigaramia aweze kujimudu na hakikisha kwamba anayo hiyo kadi ya NHIF. Wakati ambapo anaambiwa kwamba kuna shida yoyote inayotokea, anaweza kupata matibabu. Cancer is one of the diseases that's covered by NHIF. Sometimes not fully and not where we ought to be. But the services that are offered right now are adequate to ensure that cervical cancer is treated. So let women go, let men register their families, because the NHIF card covers the whole family.
You can get the super cover.
It covers the whole family. Even if it's not the super cover, the normal NHIF covers the family. Therefore, let people get registered. Let's not wait until we are told there is something going on. That's when you run to get the NHIF card, and you have to wait a period before you can enjoy the services of the insurance cover.
Very good point. Daktari Leposo in Kajiado talks about his experience on the ground there. And he says what is so unfortunate is that there is no awareness, on the ground, even telling women what they are up against. When you talk about what's happening mashinani, please add on to your thoughts about this, because he's saying those stakeholders that you are talking to, why are they not, bringing all these services and these campaigns on the ground? Please tell us.
It is true that there are some areas that are unreached with this knowledge, and knowledge is power. So what I would say maybe is appeal to all the governors in their counties.
Yeah.
To arrange kamukuji, are they called kamukuji? Those ones. Those ones. Yes. In every county, and the ward, the people who run the wards, those who are elected in the wards, to make sure that they hold those campaigns, those meetings for women to be made aware. Women for Cancer is there. I'm there. We are many, many of us who want to preach this gospel. And yet that's where it is. You see, here in Nairobi, Millie can access treatment. Right. Out there, they'll die not knowing. They'll even not have ever been screened. Absolutely. So can we talk about screening? It's so easy. And all the government, all level 4 government hospitals are able to do that screening called VIA. So can women go? And can the people, the politicians, that's why we elected them, to give us knowledge. Can they call us for us to talk? We are willing. We are willing to walk the country and tell people what should be done.
I almost feel as if like this could be such an amazing First Ladies project. If every First Lady of every county was taking this up, how far would we be? You know?
Yeah.
It really would be.
I'm laughing because we have been working with the First Ladies for a while. Yeah. And that since 2018. And the First Ladies, the first point of call is awareness and education. Absolutely. When they know about it, they will take it up as a cause. Right. And it's not just about the First Ladies. There are different voices that people listen to in the community. Healthcare workers, political leaders, community leaders, health champions in the community. The pulpit. As much as somebody, I think it was Joshua from Kirinyaga,
can the church
stay out of this? No, the church needs to be in this. And the church needs to be educated that your people are dying for lack of knowledge. And if they speak boldly about it and give people the opportunities to make the right choices, we can stop cervical cancer before it starts. And therefore, it's everybody. Anybody who has listened to us today needs to understand. Don't keep quiet with this knowledge. Go out there and talk about it. And if you're not clear and you're not aware, talk to your healthcare facility. Level 3 hospitals through to level 4 to level 5 have the services. The health workers at the community are being educated on cervical cancer prevention. It's everybody's business.
Okay. As we wind down, because we only have about 6 minutes or so, Millie, as someone who has walked this journey and you've gone through it, what is that support system that cancer patients need the most? When you think back, how can we all, chip in, put in this work?
When you are a cancer patient, the only thing you need is love. You need someone to tell you it is okay. You need someone to listen to you. You know, a lot of people come to you, even they come to you as in, you have sin. You'll find someone telling, we shika imani, utapona, unaona, imani yako hauna, unaona. So it's like kuna siku ulipiga magoti ukiambia Mungu nipatie saratani. No. So if you see a cancer patient, the only thing that patient needs is love. Chukua kiti, kapo, msikiliza anasema nini. Because if you have cancer, you go through a lot. Kuna hizo ndoto mbaya, kuna hiyo denial iko ndani yako, kuna vitu mingi unafikiria. As a single mother, you are thinking about leaving your children behind. Unaona. So, that's why unapata cancer patient sana sana ufikiria kujiua, ama kufanya nini, ama kuua familia zao. Like, there is a day I thought, naweza ua watoto wangu na pia mimi nijiue. Sababu siku anataka kuacha mtu nyuma akiteseka. Unaona? So, juu ya hiyo mawazo, huyu mtu anahitaji upendo, anahitaji mtu wa kumsikiliza sana. Na anahitaji tu mtu wa kuona anamjali. Hiyo tu peke yake inatosha. Then tukimalizia, ningependa kuongea kwa wanaume. Men, don't pretend you love your wife kama huwezi make sure bibi yako ameenda screening. Kama huwezi jali afya yako, hiyo si upendo. And then guardians, wenye wako na watoto, wenye wako na wasichana wenye wako 10 years old. This is the opportunity. Unajua, hii nafasi imekuja kwa sababu ya ule mtu mwenye ajiwezi. Na hii ni opportunity ambayo utapeleka mtoto wako akwe protected. Don't let your girls to go through what I went through.
Okay. All right, let's take a look at WhatsApp very quickly. I understand we've got some more text messages that have come in. Do you mean sex reduces the chance of getting that cancer? So should we be having sex regularly? Daktari, yes, don't shoot the messenger, by the way, that's me. But you can see the text messages are coming in. So very quickly, let's address these. You've got someone asking whether they should have sex regularly because that will reduce cervical cancer. We've got someone else who also asked about the age that is recommended to get the HPV vaccine as well, and of course, where to access the HPV vaccine. You've seen quite a number of text messages on that. In just 2 minutes so that we can wind up.
99%, 99.7% of cervical cancer is caused by human papillomavirus.
Yes.
Now, human papillomavirus is sexually transmitted. Once the virus is there, whether you have sex every day or once in a year, it's irrelevant. It will invade the cervix and it can cause cancer of the cervix. So that is not, having sex regularly will not reduce cancer. In fact, I need to say that the risks of getting human papillomavirus is having many partners.
Multiple partners.
And not only the woman having multiple partners, but her man having multiple partners. Because the minute they have intermixed partners, then the higher the chances. Like I said, it's 38% prevalence of HPV. So the chances are. Now, I want to say before we close that they are talking about no vaccine, and I want to tell about a girl who was totally a virgin. I always tell this story. Totally a virgin, got married a virgin, had never approached a man or a woman, got married, and 10 years down the line she had cancer of the cervix. Why? Because her man, who was also quite faithful since they got married, had sex before and had contracted human papillomavirus. So as we say vaccination, we are not protecting those who are going to be sexually active, because I think that's the biggest problem, that we are telling our girls to be active. We are protecting them even inside marriage, where they don't know where the human papillomavirus will have come from.
Absolutely. Okay. The other question that you can answer is, because people say taking the vaccine once you have already been diagnosed either with the cancer or you have the signs and the symptoms of it, that the vaccine will get rid of it. Why don't you deal with that misconception?
Vaccine will not treat. There is no treatment for cancer. And then any 10-year-old, actually 9-year-old, can be vaccinated all the way to age 26 if they're not sexually active.
All right, beyond 26?
If they get screened, one can be vaccinated all the way to age 45. So age 9 to age 15. The thing about age 9 to age 15 is that the vaccine, you need only 2, because the ability to take in and build immunity is bigger. But once a girl goes beyond age 15, they need to take 3.
Okay. All right. Where are we going this week for free screenings, Brenda? Please give us that highlight, and then we can say goodbye.
Where are we going? Any public, private, or faith-based hospital that has services for screening. In fact, in the government sector, any level 3, 4, or 5 hospitals, that's the clinics, the dispensaries, the hospitals, the county hospitals, have services for cervical cancer screening. Some of them charge a nominal fee, like 50 bob to open a card, or 300 shillings, depending on which hospital. However, the services are available. And it's not just about this week. Screening is available all year round. That we are in the National Cervical Cancer Awareness Month, January, is that we are emphasizing and putting more knowledge out there about prevention. But screening is available all year round. Vaccination is available all year round. And any girl who is turning 10, if she turned 10 yesterday, she's eligible for a vaccine. If she turns 10 in June, take her in June. It's available all year round. We're not saying start, stop. We're saying continuous, regular vaccination and screening.
Well, ladies, thank you so much for that. And, you know, we just want to encourage, you know, anyone who's listening, anyone who's watching, that we continue the good fight. There's definitely more you can look up as far as cervical cancer is concerned, including speaking to your health professional, as our team on set has said this morning. But of course, the key message is early screening and prevention being better than cure always. Please go and look up this HPV vaccine to understand a little bit more about it, because we need to save lives. And gentlemen, that brings us to the end.
Can men get screened as well?
Listen,
because she said clearly that, you know, we can transfer it from, you know, one woman to another due to, you know, the intercourse. So I'm assuming, is it also safe for us to get screened so that we can know that indeed it's possible for us to infect other people?
All right. Dr. would you like to answer that?
Currently, the screening for men is being done.
Yeah.
It's available in the Western world.
Okay.
We don't have it here yet.
All right. So it's available for homosexuals outside the country, but not necessarily. All right.
Okay. If you have any more questions, of course, you can tweet us. Of course, we'll make sure we forward them to the relevant authority as far as that's concerned. We are done for today.
Absolutely.
The Daily Brief is up next from 9 till 12:30. Have a great Monday. We're back tomorrow. Bye-bye.
Bye-bye. Thank you.